Episode 9. English at the Dentist. Hello and welcome back to Speak English Naturally. Today's lesson can help you in a very common real-life situation. Imagine this. Your tooth hurts. You call the dentist. You arrive for your appointment. The receptionist asks questions. The dentist examines your teeth. You hear words like cavity, filling, gum, X-ray, treatment, and suddenly, English becomes difficult. You understand some words, but you are not sure how to explain the pain. You want to ask questions. You want to understand the treatment, but you do not know what to say. If that sounds familiar, today's episode is for you. Today, we will practice useful English at the dentist. We will talk about making an appointment, checking in, describing tooth pain, having a dental checkup, understanding common treatments, asking questions, paying and booking another appointment. You will also hear natural conversations and answer questions throughout the lesson. Listen carefully, repeat the useful phrases, and speak out loud when I ask you a question. Ready? Let us begin. Part 1. Making a dental appointment. You may call the dental clinic and hear, "Hello, how can I help you?" You can answer, "I would like to make an appointment." Repeat, "I would like to make an appointment." Again, "I would like to make an appointment." You can also say, "I need to see a dentist." Repeat, "I need to see a dentist." If you have pain, you can say, "I have a bad toothache." Repeat, "I have a bad toothache." A toothache means pain in a tooth. You may also say, "One of my teeth hurts." Repeat, "One of my teeth hurts." Or, "I think I have a dental emergency." Repeat, "I think I have a dental emergency." The receptionist may ask, "Is it an emergency?" You can answer, "Yes, I am in a lot of pain." Repeat, "I'm in a lot of pain." Or, "No, it is just a regular checkup." Repeat, "It is just a regular checkup." The receptionist may ask, "When would you like to come in?" You can say, "Do you have anything available today?" Repeat, "Do you have anything available today?" Another useful question is, "What is your earliest appointment?" Repeat, "What is your earliest appointment?" The earliest appointment means the first available time. You may hear, "We have an appointment tomorrow at 10. You can answer, "That works for me." Repeat, "That works for me." Or, "Do you have anything later?" Repeat, "Do you have anything later?" Now let us practice. Imagine you have a bad toothache. You call the dental clinic. The receptionist says, "How can I help you?" What would you say? Pause and answer. You could say, "I would like to make an appointment. I have a bad toothache." Excellent. Part 2. Checking in at the dentist. When you arrive, the receptionist may say, "Hello, do you have an appointment?" You can answer, "Yes, I have an appointment at 2 o'clock." Repeat, "I have an appointment at 2 o'clock." Or, "I am here for my dental appointment." Repeat, "I am here for my dental appointment." The receptionist may ask, "What is your name?" You answer, "My name is." They may also ask, "Is this your first visit?" Repeat, "Is this your first visit?" You can answer, "Yes, This is my first visit. Repeat. This is my first visit. Or, no, I have been here before. Repeat. I have been here before. You may need to complete a form. The receptionist may say, "Please fill out this form." Repeat. Please fill out this form. Fill out means write information on the form. The form may ask about your name, your address, your medical history, your allergies, the medicine you take. You may want to ask, "Can you help me with this form?" Repeat. Can you help me with this form? Or, what does this question mean? Repeat. What does this question mean? Very useful. The receptionist may then say, "Please take a seat." Repeat. Please take a seat. Or, the dentist will see you shortly. Repeat. The dentist will see you shortly. Shortly means soon. Question for you. What could you say when you arrive for your appointment? Pause and answer. You could say, "I am here for my dental appointment." Good. Part 3. Explaining the problem. The dentist may begin with, "What brings you in today?" This means, "Why are you here?" You can answer, "I have a toothache." Repeat. I have a toothache. Another useful answer is, "My tooth has been hurting." Repeat. My tooth has been hurting. You may also say, "I have pain on the left side." Repeat. I have pain on the left side. Or, my back tooth hurts. Repeat. My back tooth hurts. The dentist may ask, "Which tooth hurts?" You can say, "This tooth hurts." Repeat. This tooth hurts. Or, "I'm not sure which tooth it is." Repeat. I am not sure which tooth it is. Another common question is, "How long has it been hurting?" You can answer, "Since yesterday." Repeat. Since yesterday. Or, "For about 3 days." Repeat. For about 3 days. Remember, use since with a starting point. Since Monday. Since yesterday. Use for with a period of time. For 2 days. For 1 week. The dentist may ask, "Is the pain constant?" Constant means the pain does not stop. You can answer, "Yes, it hurts all the time." Repeat. It hurts all the time. Or, "No, it comes and goes." Repeat. It comes and goes. The dentist may ask, "Is the pain sharp or dull?" Sharp pain can feel sudden and strong. Dull pain is often lower and slower. You can say, "It is a sharp pain." Repeat. It is a sharp pain. Or, "It is a dull pain." Repeat. It is a dull pain. You may also hear, "Does it hurt when you eat?" You can answer, "Yes, especially when I chew." Repeat. Especially when I chew. Chew means use your teeth to break food. Another question is it sensitive to hot or cold? Sensitive means it hurts or feels uncomfortable. You can answer, "Yes, it hurts when I drink something cold." Repeat. It hurts when I drink something cold. Or, it is sensitive to hot drinks. Repeat. It is sensitive to hot drinks. Now let us practice. The dentist asks, "How long has your tooth been hurting?" What would you say? Pause and answer. You could say, "It has been hurting for 3 days." Excellent. Part 4. Common dental problems. Let us learn some common words you may hear at the dentist. First, cavity. Repeat. Cavity. A cavity is a small hole in a tooth. You may hear, "You have a cavity." Repeat. You have a cavity. Another word is filling. Repeat. Filling. A filling repairs a cavity. The dentist may say, "You need a filling." Repeat. You need a filling. Another common problem is a broken tooth. Repeat. A broken tooth. You may say, "I think I broke a tooth." Repeat. I think I broke a tooth. Another problem is a loose tooth. Repeat. A loose tooth. Loose means the tooth can move. You may also hear gum disease. Repeat. Gum disease. Your gums are the soft pink area around your teeth. You may say, "My gums are bleeding." Repeat. My gums are bleeding. Or, "My gums feel sore." Repeat. My gums feel sore. Sore means painful or uncomfortable. Another common phrase is, "My face is swollen." Repeat. My face is swollen. Swollen means larger than normal because of a problem. You might also say, "My jaw hurts." Repeat. My jaw hurts. Your jaw helps your mouth open and close. Now repeat the key words: cavity, filling, broken tooth, loose tooth, gums, swollen, jaw. Excellent. Part 5. During a dental checkup, the dentist may say, "Please sit back." Repeat. Please sit back. Then, open your mouth, please. Repeat. Open your mouth, please. You may hear, "Open a little wider." Repeat. Open a little wider. Or, "Turn your head to the left." Repeat. Turn your head to the left. Another instruction is, "Try to relax." Repeat. Try to relax. The dentist may use a small mirror to examine your teeth. They may say, "I am going to check your teeth and gums." Repeat. I am going to check your teeth and gums. You may also hear, "You may feel a little pressure." Repeat. You may feel a little pressure. Pressure means a pushing feeling. The dentist may ask, "Does this hurt?" Repeat. Does this hurt? You can answer, "No, it is okay." Repeat. It is okay. Or, "Yes, that hurts." Repeat. That hurts. You can also say, "That area is sensitive." Repeat. That area is sensitive. If you need a break, you can say, "Can we stop for a moment?" Repeat. Can we stop for a moment? Another useful phrase is, "I need a short break." Repeat. I need a short break. Very useful. Some dentists may say, "Raise your hand if you need me to stop." Repeat. Raise your hand if you need me to stop. Now imagine you feel uncomfortable during the checkup. What could you say? Pause and answer. You could say, "Can we stop for a moment?" Good. Part 6. Dental X-rays. The dentist may want to take an X-ray of your teeth. You may hear, "We need to take an X-ray." Repeat, "We need to take an X-ray." Or, "I would like to take an X-ray of this tooth." Repeat, "I would like to take an X-ray of this tooth." The dental assistant may say, "Please bite down gently." Repeat, "Please bite down gently." Bite down means close your teeth on something. You may also hear, "Stay still." Repeat, "Stay still." Or, "This will only take a few seconds." Repeat, "This will only take a few seconds." You may want to ask, "Why do I need an X-ray?" Repeat, "Why do I need an X-ray?" The dentist may answer, "We need to look under the tooth," or "We need to check for a cavity." You can also ask, "Is the X-ray safe?" Repeat, "Is the X-ray safe?" Another useful question is, "How many X-rays do I need?" Repeat, "How many X-rays do I need?" Now listen to this short conversation. Dentist, "I would like to take an X-ray of your back tooth." Patient, "Why do I need an X-ray?" Dentist, "I need to check for a cavity." Patient, "Will it hurt?" Dentist, "No, it will only take a few seconds." Patient, "Okay, very natural." Part 7. Understanding treatment. After the checkup, the dentist may explain what they found. You may hear, "You have a small cavity." Repeat, "You have a small cavity." Or, "This tooth needs a filling." Repeat, "This tooth needs a filling." You may also hear, "The tooth is infected." Repeat, "The tooth is infected." An infection means harmful bacteria are causing a problem. The dentist may say, "You may need antibiotics." Repeat, "You may need antibiotics." Or, "You may need a root canal." Repeat, "You may need a root canal." A root canal is a treatment inside the tooth. You may also hear, "The tooth may need to be removed." Repeat, "The tooth may need to be removed." Removed means taken out. Another word is extraction. Repeat, extraction. A tooth extraction means removing a tooth. You may want to ask, "What treatment do I need?" Repeat, "What treatment do I need?" Another useful question is, "Do I need treatment today?" Repeat, "Do I need treatment today?" You can also ask, "Are there any other options?" Repeat, "Are there any other options?" This means, "Is there another treatment I can choose?" Another important question is, "How long will the treatment take?" Repeat, "How long will the treatment take?" And, "How much will it cost?" Repeat, How much will it cost?" Very useful. Part 8. Local anesthetic and numbness. Before some treatments, the dentist may use a local anesthetic. This medicine stops you from feeling pain in one area. You may hear, I am going to numb the area. Repeat. I am going to numb the area. Numb means you cannot feel the area normally. The dentist may say, you will feel a small pinch. Repeat. You will feel a small pinch. Or, your mouth may feel numb for a few hours. Repeat. Your mouth may feel numb for a few hours. You may want to ask, will the treatment hurt? Repeat. Will the treatment hurt? Another useful question is, how long will the numbness last? Repeat. How long will the numbness last? You can also ask, can I eat after the treatment? Repeat. Can I eat after the treatment? The dentist may say, wait until the numbness is gone. Repeat. Wait until the numbness is gone. Or, avoid hot food and drinks. Repeat. Avoid hot food and drinks. Avoid means do not have or do not use. And now, imagine. The dentist says your mouth will be numb. What could you ask? Pause and answer. You could ask, how long will the numbness last? Excellent. Part 9. During treatment, the dentist may give you simple instructions. Open your mouth wider. Repeat. Open your mouth wider. Stay still. Repeat. Stay still. Try to relax your jaw. Repeat. Try to relax your jaw. Bite down gently. Repeat. Bite down gently. Rinse your mouth. Repeat. Rinse your mouth. Rinse means move water around your mouth and then spit it out. You may hear, spit into the bowl. Repeat. Spit into the bowl. Another common phrase is, we are almost finished. Repeat. We are almost finished. If you feel pain, you can say, I can feel that. Repeat. I can feel that. Or, it is starting to hurt. Repeat. It is starting to hurt. You may also say, could you stop for a moment? Repeat. Could you stop for a moment? It is important to tell the dentist if you feel pain or discomfort. Part 10. Questions after treatment. After treatment, you may want to ask several questions. Can I eat now? Repeat. Can I eat now? What should I avoid? Repeat. What should I avoid? How long will the pain last? Repeat. How long will the pain last? Should I take pain medicine? Repeat. Should I take pain medicine? How often should I take it? Repeat. How often should I take it? Can I brush my teeth tonight? Repeat. Can I brush my teeth tonight? When should I come back? Repeat. When should I come back? What should I do if the pain gets worse? Repeat. What should I do if the pain gets worse? The dentist may give you instructions such as, take this medicine twice a day. Repeat. Take this medicine twice a day. Avoid hard food. Repeat. Avoid hard food. Do not chew on this side. Repeat. Do not chew on this side. Brush gently around the area. Repeat. Brush gently around the area. Call us if the pain gets worse. Repeat. Call us if the pain gets worse. Very useful. Part 11. Routine cleaning. Not every dental appointment is for pain. Sometimes you visit for a regular checkup and cleaning. You may say, I am here for a routine checkup. Repeat. I am here for a routine checkup. Or, I am here for a cleaning. Repeat. I am here for a cleaning. The dentist or hygienist may say, you have some plaque on your teeth. Repeat. You have some plaque on your teeth. Plaque is a soft layer that can build up on teeth. You may also hear, you need to floss more often. Repeat. You need to floss more often. Floss means clean between your teeth with dental floss. Another phrase is, brush twice a day. Repeat. Brush twice a day. You may want to ask, am I brushing correctly? Repeat. Am I brushing correctly? Or, how often should I floss? Repeat. How often should I floss? Another question is, which toothbrush should I use? Repeat. Which toothbrush should I use? The dentist may say, use a soft toothbrush. Repeat. Use a soft toothbrush. Or, do not brush too hard. Repeat. Do not brush too hard. Question for you. How many times a day do you brush your teeth? Answer in English. Pause and answer. You could say, I brush my teeth twice a day. Good. Part 12. Paying and making another appointment. After the appointment, you may return to the reception desk. The receptionist may say, how would you like to pay? Repeat. How would you like to pay? You can answer, I will pay by card. Repeat. I will pay by card. Or, can I pay in cash? Repeat. Can I pay in cash? You may want to ask, how much is the appointment? Repeat. How much is the appointment? Another useful question is, does my insurance cover this? Repeat. Does my insurance cover this? You may also hear, you need another appointment. Repeat. You need another appointment. The receptionist may ask, would you like to book it now? Repeat. Would you like to book it now? You can answer, yes, please. What appointments are available? Repeat. What appointments are available? Or, can I call later? Repeat. Can I call later? You may also ask, can you give me a reminder? Repeat. Can you give me a reminder? Now listen to this short conversation. Receptionist. You need another appointment for the filling. Patient. When should I come back? Receptionist. Next week. Patient. What appointments are available? Receptionist. We have Tuesday at 11. Patient. That works for me. Very good. Part 13. Common phrase review. Let us review the most useful phrases from today. Repeat each one after me. I would like to make an appointment. I have a bad toothache. One of my teeth hurts. Do you have anything available today? I am here for my dental appointment. This is my first visit. My tooth has been hurting for 3 days. It hurts when I chew. It is sensitive to cold drinks. My gums are bleeding. Can we stop for a moment? Why do I need an X-ray? What treatment do I need? Are there any other options? Will the treatment hurt? How long will the numbness last? Can I eat after the treatment? What should I avoid? What should I do if the pain gets worse? When should I come back? Excellent work. Part 14. Mini conversation practice. Now let us practice several full conversations. Listen carefully, then answer the question. Conversation 1. Making an appointment. Receptionist. Good morning. How can I help you? Patient. I would like to make an appointment. Receptionist. Is it for a regular checkup? Patient. No. I have a bad toothache. Receptionist. How long has it been hurting? Patient. Since yesterday. Receptionist. We have an appointment at 3 this afternoon. Patient. That works for me. Question. Why does the patient need an appointment? Pause and answer. The patient has a bad toothache. Good. Conversation 2. Checking in. Receptionist. Hello. Do you have an appointment? Patient. Yes. I have an appointment at 3 o'clock. Receptionist. Is this your first visit? Patient. Yes, it is. Receptionist. Please fill out this form. Patient. What does this question mean? Receptionist. It asks about your allergies. Patient. Okay, thank you. Question. Is this the patient's first visit? Pause and answer. Yes, it is excellent. Conversation 3. Explaining pain. Dentist. What brings you in today? Patient. My back tooth hurts. Dentist. How long has it been hurting? Patient. For about 3 days. Dentist. Does it hurt when you eat? Patient. Yes, especially when I chew. Dentist. Is it sensitive to hot or cold? Patient. Yes, it hurts when I drink something cold. Question. When does the tooth hurt more? Pause and answer. It hurts more when the patient chews or drinks something cold. Very good. Conversation 4. During the checkup. Dentist. Please open your mouth. Patient. Okay. Dentist. Open a little wider. Does this hurt? Patient. Yes, that area is sensitive. Dentist. I understand. Raise your hand if you need me to stop. Patient. Okay. Question. What should the patient do if they need the dentist to stop? Pause and answer. The patient should raise a hand. Excellent. Conversation 5. Discussing treatment. Dentist. You have a cavity in your back tooth. Patient. What treatment do I need? Dentist. You need a filling. Patient. Will it hurt? Dentist. I will numb the area first. Patient. How long will the treatment take? Dentist. About 40 minutes. Patient. Okay. Question. What treatment does the patient need? Pause and answer. The patient needs a filling. Good. Conversation 6. After treatment. Patient. Can I eat after the treatment? Dentist. Wait until the numbness is gone. Patient. How long will that take? Dentist. About 2 hours. Patient. Should I take pain medicine? Dentist. Only if you need it. Patient. What should I do if the pain gets worse? Dentist. Call the clinic. Question. How long may the numbness last? Pause and answer. About 2 hours. Excellent. Conversation 7. Routine checkup. Dentist. Your teeth look healthy, but you have some plaque. Patient. What should I do? Dentist. Brush twice a day and floss more often. Patient. Am I brushing correctly? Dentist. You are brushing too hard. Use a soft toothbrush. Patient. Thank you. Question. What kind of toothbrush should the patient use? Pause and answer. A soft toothbrush. Very good. Part 15. Your speaking challenge. Now it is your turn. I will ask you questions. Answer out loud in a full sentence. Question 1. Why are you at the dentist? Pause and answer. You could say, I have a toothache. Question 2. How long has your tooth been hurting? Pause and answer. You could say, it has been hurting for 3 days. Question 3. When does it hurt? Pause and answer. You could say, it hurts when I chew. Question 4. Is it sensitive to hot or cold? Pause and answer. You could say, yes, it is sensitive to cold drinks. Question 5. What would you ask before treatment? Pause and answer. You could ask, will the treatment hurt? Question 6. What would you ask after treatment? Pause and answer. You could ask, can I eat after the treatment? Excellent. Now let us do one final role play. You are the patient. I am the dentist. Answer each question out loud. Hello. What brings you in today? Pause and answer. Which tooth hurts? Pause and answer. How long has it been hurting? Pause and answer. Does it hurt when you chew? Pause and answer. Is it sensitive to hot or cold? Pause and answer. Do you have any questions about the treatment? Pause and answer. Excellent work. You have now practiced a complete dental conversation. Before we finish, remember something important. You do not need perfect English at the dentist. Short sentences are enough. You can point and say, this tooth hurts. You can ask someone to repeat. Could you say that again, please? Repeat. Could you say that again, please? You can ask them to speak slowly. Could you speak more slowly? Repeat. Could you speak more slowly? You can also say, I do not understand this word. Repeat. I do not understand this word. And if you feel pain, say it clearly. That hurts. Repeat. That hurts. Answer. Please stop for a moment. Repeat. Please stop for a moment. These phrases can help you feel safer and more confident. Now it is time for today's comment challenge. Imagine the dentist asks, what brings you in today? What would you say? Write one sentence in the comments. For example, I have a toothache, or my tooth hurts when I chew, and tell me, which phrase was new for you today? If this lesson helped you, please like the video. Your likes help more English learners find these lessons. Subscribe to Speak English Naturally for more practical English conversations. And share this episode with someone who may need English at the dentist. You can also watch the complete medical English series, English at the doctor, English at the pharmacy, English in the emergency room, English in the ambulance, English at the hospital, English during a medical checkup, English for blood tests, English for x-rays and scans. Now, English at the dentist. Watching the full series will help you understand more medical English and speak with greater confidence. Keep listening, keep repeating, keep speaking, and little by little, your English becomes more natural. Thank you for learning with Speak English Naturally. See you in the next episode.